Hi everyone. As you all know, we are conducting the autoimmune masterclasses and we did a wonderful session 3 yesterday. It went on for an hour longer than we expected. Normally, each session is about 2 hours. We usually exceed it by 15, 20 minutes, max 30 minutes. But yesterday's session was 1 hour, 15 minutes more than what we had factored in, simply because autoimmune conditions are so complex and so multidimensional in their attacks. And, you know, for me to be able to put three categories, first, my own personal experience with rheumatoid arthritis and how I overcame it and healed myself. Uh, then getting certified as a nutritional therapist to treat autoimmune conditions, and then finally in the last 12 years to treat autoimmune conditions across the world, to be put into just 4 sessions obviously becomes exhausting and difficult. And even for those attending my classes, the questions are just so many. Uh, there was a mix of doctors, healers, complementary medicine therapists, autoimmune warriors, and people who wanted to prevent them, people who have peripheral autoimmune responses like allergies, eczema, asthma. Their immune system is a little compromised. So even people like that have signed up for the class. Then there is another category of people who signed up for the class, which is wanting to have a good immunity to protect themselves in this environment. So the class was a mix of all these people, and of course, my favorites were and are the warriors. Um, so the questions from the warriors, of course, I related a lot of those to myself and my own healing journey, and we had a wonderful, wonderful session. We covered, we've till now had uh, 3 sessions. We've already covered in the autoimmune masterclass what are autoimmune conditions, side effects of the disease itself, early signs before diagnosis, side effects of medications, why are they incurable, secondary and tertiary autoimmune conditions, understanding the triggers, why do some people get it and some don't get it, how can nutrition work when medicine has failed. So we in the session 2 we went into a lot of details into how can nutrition work when medical science has failed, and we covered a large part of the physical and emotional nutrition that helped me and that helped a lot of my patients. We understood the pillars of healing, we understood how to cope, we understood what are the things that you need to do in case of a flare up. And in yesterday's class, we not only did a recap of all those pillars, but the problems that happen in implementing those pillars. Anybody can give, any healer, doctor can give you a wonderful plan to follow, but there are practical steps to implement it, and any gap in following those steps for specifically a multidimensional deadly disease like any autoimmune condition like rheumatoid arthritis, multiple sclerosis, psoriatic arthritis, psoriasis, ankylosing spondylitis, and so many 100 plus conditions that are there. The implementation of the pillars of healing, and these pillars of healing are both physical nutrition and emotional nutrition. For those warriors out there who are going through it, already know that autoimmune flare ups are triggered because of anxiety, because of stress. And we are, I always call these special children of God who are extremely sensitive as people. So how do you change your response to stress? So, emotional nutrition is a large part of my healing, which was covered in the last session. And yesterday's class was more about implementing these pillars of healing on a day to day basis, so that consistently we can start going to the root causes. The reason that nutritional therapy and my treatment has worked in autoimmune patient cases is because we are giving them the consistent input and attacking the disease from a cause perspective. The causes are a compromised immunity. The causes are a presence of toxins. The causes are emotional sensitivity. The causes are malnutrition. Now, when you look at all these causes and you start addressing the causes, it's like building a 30-story building right from scratch. So you will end up going to minus 30, and if you compromise going to minus 30 and you go to minus 10, then you're not going to be doing justice to those causes. So we address the causes, and then minus 30 to 0 is the journey of building the immune system, and the consistency of the input of physical and emotional nutrition and the steps that we discussed in the last session ultimately lead to reduced inflammation markers, reduced pain, reduced symptoms, and lower antibodies. Now, moving forward, we next week we are going to have the final session for this particular batch. So, this final session for this particular batch is going to have caregiver coping techniques, the new normal pillars for living a free life, and a revision of what all we did with some case studies being discussed. We will be coming to an end for the autoimmune masterclass for this batch next week. And I have already announced that the new batch is starting in November, and some of you have already signed up. Seats are going. So, if you are a doctor, a rheumatologist, a complementary medicine therapist, a nutritionist, an Ayurveda expert, a yoga therapist, a caregiver, and you are committed to making the quality of life of an autoimmune patient better with or without medication. I chose to quit medication. A lot of people end up saying that we will not quit medication, but we will have a better quality of life in terms of high nutritional status, so that the toxicity of those medicines is affecting our liver and kidney readings, and our chronic fatigue and pain levels can start getting reduced. So, whatever choices you may want to make, nutritional healing for autoimmune conditions is not an option. So, if you're committed to helping people with autoimmune conditions, which are incurable in medical science, if you want to help them to get a better quality of life, if you want to help yourself to live a life without pain and chronic fatigue and brain fog, these master classes are a must. We are starting the new batch in November. The classes are divided into 4 sessions of 2 hours each. And as I said in the beginning, they are an amalgamation of what I went through as a patient, the treatments, the toxic treatments I went through, and then how holistic healing worked for me to make me clinically negative for rheumatoid arthritis. Then I studied nutritional therapy. Then for 12 years, I have been treating autoimmune patients across the world. And my learnings with each patient, the clinical markers before they come, when they come to me for treatment, and after they are fine, and how these markers start coming down, how symptoms start coming down, how quality of life becomes better, is the focus of these master classes. So if you would like to join the master classes, I am going to give the link at below in the comments, and you must sign up for these master classes so that you can help somebody struggling with this condition. If you're a doctor or a rheumatologist, medications do not have the answer. You already know that. So help the patients by protecting their liver, kidneys, because most autoimmune patients do not die early because of the disease. They die early. Statistically, the data is that by the time they are in their early to mid 60s, a lot of them succumb to the side effects of the toxic drugs like methotrexate. There is multiple organ failure that happens. So, as a rheumatologist, as a doctor, if you are looking at really caring for your patients, please do sign up for the masterclass so that you can help them. If we join hands together, we can treat autoimmune conditions better, and we can eliminate them just like I eliminated mine. see.